So what does DSM-5 says? This classification is same as ICD-11. Okay, the problem in reading accuracy, fluency and comprehension, spelling accuracy, grammar, punctuations, or poor organization of written expression, or problem with the number sense, memorization of arithmetic facts like tables, or poor fluency in calculation, or poor mathematical reasoning. Okay, basically the structure of the diagnosis is same in ICD-11 and DSM-5. Okay. Here it is called a specific learning disorder. But DSM go on to divide specific learning disorder into mild, moderate and severe. Okay. What is mild specific learning disorder? Difficulty in learning in one or two academic domain. Mild enough severity that individual will be able to compensate or function when provided with appropriate accommodations or support services. Okay. We will see what is accommodation modification in the treatment section. Basically mild, whenever they have appropriate accommodations in the classroom, they will be able to compensate. And symptoms are mild. Moderate, it is a marked difficulty in learning skills in one or more domain, unlikely to become proficient without intense specialized teaching. Okay, without mild can function with just accommodation. But moderate, it requires intense specialized teaching during school years. Without the specialized teaching, the children with moderate specific learning disability will not be able to become proficient. Okay, and even after specialized teaching, it requires some accommodation or supportive services in the school, workplace or home for them to function efficiently. So here, when you give intense specialized teaching and have some modification and supportive services, they will be able to function accurately and efficiently, which is not the case in severe. Here affecting one or more domains, individuals unlikely to learn without specialized teaching, without intense remediation, they will not be able to function. But even with specialized teaching and even with appropriate accommodation, the children with severe specific learning disability will not be able to function adequately. So mild, with some accommodation itself, they will be able to function. Okay. Moderate, it requires specialized teaching and accommodations and modification. With that, they will be able to function. Severe, it definitely requires specialized teaching. Even with accommodation or modification and specialized teaching, they will not be able to function to the grade level. So this is how DSM classifies into mild, moderate and severe specific learning disability. So what are the clinical features? Okay, I told about problem in reading, writing, math. So what exactly, how the child will present with a specific learning disability? Here it differs from different age group. Okay, so preschool children with at-risk specific learning disorder. Okay, here we put it as at-risk because we cannot diagnose as a specific learning disorder in this age group. So how they will present? Lack of interest in playing games with language sounds. Okay, so usually the children will play word games, so they will have lack of interest. Usually preschool children will learn nursery rhymes quickly. They will have trouble learning nursery rhymes. So still the speech has poor pronunciation, like they will mispronounce words. They will have poor clarity in speech. Trouble remembering names of the letters. Usually they will identify alphabets in this age. They can say days of the week. Here the children with at-risk SLD, they will not be able to do so. And they will fail even to recognize alphabets in their own names, and they have problem in counting. So these are the indicators of specific learning disorder in the preschool age group. Kindergarten age group, okay, KG1 and KG2. Again, they will have problem in recognizing and writing letters. So kindergarten, they will start writing letters. Here they will have problem, okay, and unable to write their own name. And they may use invented spelling, okay, so some random spelling, okay, and they have problem in breaking spoken words and breaking, for example, cowboy, they will be able to break cow and boy, two words here, and they will have problem in breaking this word into syllable, okay, CO like this, okay, so they have problem in breaking down spoken words into syllables, and trouble recognizing rhyming word, cat, bat, hat, okay, so when we ask them to identify rhyming words, they will have problem in that, and the problem in connecting letters with their sound. These are all the things I told about phonemic awareness. Okay, basic phonemic awareness is connecting letter with the sound. Okay, so this is the basic cognitive error in problem that will present as reading disability. And they have problem in recognizing phonemes. Okay, do not know which set of word has that start with same phonemic sound as cat. Okay, so here they have to identify both have start with ka. Okay, in children with at-risk SLD, they will not be able to do so. Okay, so basically here in kindergarten age group, they will not be able to recognize words which we saw in preschool age group. Here, along with that, they will have problem in phonemic awareness. Primary grades, okay, here they continue to have problem in manipulating phonemes, which we saw in the kindergarten age group. Here, they have problem in reading, okay, they commit lots of reading errors.